Now on BBC One, we join Margot MacDonald in her advice shop.
Hello. In Advice Shop this week we're looking at some of the chief benefits you can claim if you're disabled. Today we're featuring a benefit called attendance allowance. This is a weekly benefit that's paid to someone who needs a lot of looking after because of physical or mental disability. 250,000 people claimed attendance allowance for the first time last year, and over 70% of them were successful. Now, the allowance can be claimed for any disabled person who's over the age of 2. So it's a benefit for young and old alike, and there are 2 different rates of benefit. If you need looking after during the day or during the night, you could get £20.65 a week, and that goes up to £21.10 in April. But if you need round-the-clock care 24 hours a day, you could get £30.95 a week, going up to £31.60 in April. It's tax-free, and it doesn't affect any other benefit you might qualify for. This is one benefit that can make a terrific difference to disabled people and the people who care for them. Yet, there are plenty of people missing out on attendance allowance, particularly elderly people who need looking after at home. Although in Harlaw, Essex, there's perhaps fewer people in the dark about attendance allowance, because Ben Fraser makes sure that they're told about it.
Being a pensioner, sort of ancient Britain myself, I'm disabled, I'm on supplementary benefit. And the Harlow Benefits Action Campaign, first of all, they thought it might be a good idea if I did something about the welfare rights here at the Williams Day Hospital. The whole idea of the place is to take people in who, just for the day, who are mostly stroke victims and things which aren't uncommon to the elderly sort of thing. And we look after about 40 people a day, about 200 people a week. Very often they're brought in for treatment, various kinds of therapies, and also to see the doctor.
I can't push it in.
Try and bend it at the elbow, Harry.
And very often they're brought in just to give the carer, son, daughter, wife, husband, whoever, to give them a break for a day and let them get out and do the normal things they would do if they could get out during the day. I'll come in on average 1 day a week, and what happens is, assistant in charge, she selects 3 people a day for me. Each day I go in, she has selected 3 patients who I interview, and I find out about what their income is and what their outgoings are, find out if they're receiving any other benefits which they should be getting, such as attendance allowance. I don't think you'll have any problem in getting the allowance. And it's good news, really, because you're going to be about £20.60 better off each week when you get that. It's well worth having, isn't it?
It is, yes.
It's a shame nobody's told you, because you've not been well for a long time, have you?
No.
There's so many people come to these places and they're absolutely lost. They don't know, they just don't know what's going, they don't know what they're entitled to. Nobody tells them. And it's all very sad. And the whole exercise is, as far as I'm concerned, is to try and make them better off. I have to ask you a few questions about the details of your weekly income, Amy, and how much rent you're paying, things like that.
Yeah.
But if you can't remember them, I think daughter, she knows what they are.
Yeah.
So first of all, can you tell me what the retirement pension is, please?
39.
Occupational pension. Do you get any occupational pension? No war pensions, no other pensions. Severe disablement allowance, you wouldn't qualify for that. No invalidity benefit, you wouldn't have claimed for. Mobility allowance, unfortunately, you're too old for. Attendance allowance, have you ever claimed attendance allowance?
No, I haven't claimed anything at all.
Do you know what attendance allowance is?
No, I haven't a clue.
Has anybody ever told you?
No.
It's still on the secrets list, that one,
Oh,
unfortunately.
is it?
Would you like us to complete the form for you today and apply for it?
Well, if you think I might qualify
I think you would
for it,
qualify,
yeah.
yeah, because you need a lot of attention, don't you? You've got to have lots of things done for you.
Yes, I do.
Something else I should point out as well, Mrs. Rampre, if your mother does get the attendance allowance, you drive the car. You do all the shopping and prescriptions and collect the pension and all the other bits and pieces. A lot of people don't realise, but if you're getting the attendance allowance, you can nominate someone as your driver, like in your case, your mum. So it would entitle your mum to nominate you as her driver, and you wouldn't have to pay the car tax.
I didn't realise that.
Yes,
I take her to the hospital, I take her to the
That's right.
optician,
Yeah.
and anywhere else she wants to go. But I didn't realise that
Yeah.
was available.
Well, this is the point. You see, people don't know about these things. It's very sad. You know, so many people miss out in lots of ways, and that's not. You know, it's £2 a week. It's not.
Yes.
You know, it's well worth having. What will happen? We'll complete the attendance allowance form today. In about 2 weeks' time, you should receive an acknowledgement from the Department of Health and Social Security to say they've got your application. Maybe about 3 or 4 weeks after that, the doctor will contact you to say that he's going to come and examine you. What he actually does, he takes your blood pressure, asks you lots of questions about the things you need help with.
So the visit from the doctor is obviously going to be a red letter day for anyone claiming attendance allowance. And to advise us on just how to handle that, straight from the Harlow Benefit Campaign, Ben Fraser. What should people do to get ready for the doctor's visit?
Well, perhaps I could prepare a sort of a diary for the few weeks before the doctor arrives, which will remind them of the various things they need help with. And the next thing I would suggest is that they do have somebody with them when the doctor comes along, because I think that's very important, because they're likely to forget things, and sometimes the handicapped people don't always admit that they are handicapped, and they can give the doctor the impression that they're not as bad as they need to be to obtain the allowance.
Fine. Now, in the film, we saw Ben interviewing a lady about attendance allowance. So let's have a look at what happens next.
Having wrapped everything up at the Williams Day Hospital, the next job is to make my way, which is on my way home, to the Harlow Advice Centre. And the people there, the welfare rights officers, they're the professionals. You know, I'm just an amateur sort of thing.
So just a question of checking whether she's entitled to supplementary pension or not.
Yes,
Shall we just make a quick call to the Social Security Office now
yes,
and
please, Tony,
check that?
Thanks very much. When it comes down to the nitty-gritty, Tony Bennett and his team, they're the people who know exactly what these people should be getting. And all I do is I pass the paperwork over to them,
Yes.
and they sort out all the figures and usually come up with the answers.
Right. Well, obviously that's something we'd like to look into. That's most helpful anyway. Thank you ever so much. Yes. Bye-bye. Well, in fact, she's not getting any allowance towards heating. She's not getting anything towards any expenses on clothing or laundry or anything of this kind of thing. So I think we'll write to the DHSS and ask them to visit her, because
Yes, yeah.
surely she's going to get some help towards those
I should
items. I
imagine
think.
so, yeah.
Whenever he can, Ben finds time to visit the people he's helped to make sure their claim was successful.
Well, Mrs. Atkinson, I was pleased to hear about the attendance allowance result.
Yes, I was
It was-
surprised too.
I suppose you were. Did it take long before the doctor came after I interviewed you and helped you to fill the
No,
form?
I think it was about 2 or 3 weeks, no more than
The
that.
doctor came. How did he get along with the doctor?
Oh, fine. Well, he just asked me what I could do, what I can't do.
Mm-hmm. There's not really a great deal he can do, is
No,
there?
no.
Yeah. Was it a frightening experience, the doctor coming and asking you
No,
questions?
no.
Very nice.
No, because I've got nothing to hide.
That's right, yeah. And is that extra bit of cash going to help you?
It
Make a
will,
difference?
yes. Oh, yes.
Oh, I get a lot of satisfaction out of it. I think it's good for me anyway to be doing something, but, you know, otherwise I'd be sitting on my backside at home. And I think it's nice to be able to help people like that. All through my working life, I was a shop steward, so if you like, you know, I'm probably a shop steward for handicapped ancient Britons, I don't know, but I like doing it. I get a hell of a lot of satisfaction, and I wouldn't miss it for anything.
Ben, we need more like you, so how do other people get started?
Well, I think it's a matter of perhaps going along to the local Citizen Advice Bureau, or if they've got an advice centre, go along there, and they'll find that the people there are very helpful. They can give them material to read up and get polished up on these various things, on the benefits and such like. And from there, you know, a few weeks training, get in touch perhaps with the local housing department, or get in touch with the local hospital and ask them if, you know, could they use them in any way? Could it come along and perhaps, as a, you know, I've got a good chance of making them people a bit better off, making life a lot easier for people.
I think people would probably jump at that. Ben, thank you very much, and good luck in the campaign in Harlow.
Thank you.
Now,